Start.
Good afternoon, everyone. I am here to demonstrate regarding the ECG, or what we call electrocardiogram, or the 12 leads to be placed on the client's chest. What's the purpose of doing this demonstration? So the ECG is a demonstration on the client who will undergo electrocardiogram because the patient's need, or the hearts of the patient needs to be examined. The electroconductivity of the patients need to be assessed also. So, before I'm going to proceed for the proper return demonstration, I just want to introduce my equipments and other materials for me to be used in order to perform the return demonstration. So, I have here an electrogel. What's the purpose of having this electrogel? So, this electrogel will help establish a attachment between the skin and to the leads to be placed on the different parts of the body, to the chest part and to the lower and upper extremities. So, I also have here an alcohol for me to sanitize my hand to prohibit the spread of microorganisms while performing the procedures. And I also have here an improvised machine for ECG because since I don't have an ECG machine, I just improvise an equipment for me to use. I have here a box of ECG machine and also a nebulizer as a substitute or an alternative for doing the procedure. So the 4 links to be attached at the lower and upper extremities, the right and left arms and legs, and I have also here the 6 leads with different colors to be placed on the chest of the client while doing the procedure. So, let's move on to the proper demonstrating the different kinds of procedure during this ECG. So, the first that we are going to consider is to review the patient's conditions, the patient's history or the current condition of the patients. Also, we need to obtain information from the client and for the need for ECG. Why the clients need to undergo an ECG. So, I'm going to ask my patient, "Good morning, ma'am. Sinabi po ba ng doktor niyo na mag-a-undergo kayo ng ECG?" Some clients undergo ECG because their doctor prescribed them to have this kind of procedure. Maybe they are suffering from kind of heart conditions or heart failures that may affect the following organ of their hearts. So, and the second, we need to keep the body of the client away from the materials or things that may cause electrical interference, such as equipment, such as wire cords. Also, the following materials that may cause electrical impact to the client, such as the metal, coins, or the watch. Sir, may coins po ba kayo dyan sa bulsa nyo? Or yung mga watch po na nilagay sa any metallic kind of na accessories po sa katawan nyo? Okay, if the span of the clients is correct, na wala naman siyang nilagay sa katawan niya, then you may proceed on the following procedures. And then, you are now going to assess the client's chest. But before you're going to proceed on the client's chest, you may ask the client if he or she wants you to open or expose her private part. This is to provide privacy to the client. So tanungin mo muna sa pasyente mo kung gusto niya, "Ma'am, pwede ko po bang expose yung damit nyo, buksan yung butones?" If the client responds yes, you may continue doing the procedure. So, why we are going to assess the chest part of the client? It is because we need to take note what are the following problems, such as if the chest part has a excessive hair growth that may interfere the placement of the leads on the chest part. So if also the clients have cuts or wounds or nodules, presence of masses and breakdowns on the chest areas. And also we need to take note the areas of irritation in the chest. Okay? Everything is okay. Ma'am, i-close ko na po. So So after inspection, you also need to reclose the cloth of the clients. After doing that, let's now proceed to assembling our equipment. So we need to assemble our equipments. So the equipments are already assembled. Make sure that the machine is placed close to your clients, and then you're now going to plug the outlet into the wall. So assume I have already plugged into the wood. And then we're now going to perform the procedure. But first and foremost, that we're going to place the lids on the chest part of the clients, we need to sanitize our hands. If soap is not available, we need to make use of our alcohol. Following the eye wash day. This is to prohibit the spread of the microorganisms. And then, you're now going to identify the client's identity. Ma'am, ano pong pangalan nyo? If you're not contented with the client's response to you, you may continue to check on the client's and the identification bracelet. So assume that I'm holding the client's identification bracelet. So to verify the client's identity, oh yes, the client is correct. Then proceed on the procedures. You're going now to introduce the procedure to the client. So ma'am, today you are going to undergo the ECG procedure wherein the electroconductivity of your heart will be tested, and also the function of your heart through via visual presentation. It will be assessed and it will be examined. And then after doing that, you're now going to provide privacy to the patient. It is important to provide privacy to the patients because you're going to expose the critical parts or the private parts of the patient. So if you are enclosed with the curtain, you need to close the curtain. So assume that I had already closed the curtains. And then after closing or providing privacy to your clients, you need to reposition the clients in supine position or in a comfortable position to provide comfort. And doing some examination of ECG, the most appropriate position of client is in lying or in supine position. So we need to support the base of the neck or the head. Then position the client in supine or in lying position. After positioning the client, you need to instruct the client that as much as possible, stay still on the bed and refrain from talking while ongoing to the procedure. Why? Why it is important to instruct the client? Because talking or doing something while ongoing to the procedure may interfere the procedure that we are performing. Then, we're now going to switch on, after plugging the electrical wire into the outlet, we're now going to switch on the machine. And do not forget to properly ground the machine. So assume that I already placed there. I already switch on the machine, and I'm now going to place the limbs lid of the ECG machine. But before that, we're going to apply electrogel. So the yellow one will be placed on the left arm. So place an electrogel, just assume. Then place on the left arm of the client. So this is the left arm of the client. Assume that this is the arm of the client. I'm going to place it. And also the red one will be placed on the right arm of the client. So place an electric gel. Do not forget to put and we have also links for the lower extremities. So the color green will be placed on the left leg of the client. So just assume that I'm going to place this lymph lead to the left leg of the client. So where's the left? Here. And the black one to be placed on the right leg of the client. And then we're now going to expose the chest of the client. But before that, you're going also to ask permission again to the client before placing the leads on the chest of the client. So ma'am, can I open again your buttons or your clothes? If the client's response yes, you may continue doing the procedures. But making sure that the curtains or doors are closed to provide privacy to the clients. So here are the 6 leads to be placed on the chest part of the clients with different colors. So we're going to begin on the red one. So this what we call the V1. The V1 or the V1 leads is the first one to be placed on the client's chest. So let's put a electrogel. So we are going to locate this V1. It is important to take note that in the body or in the sternum part or in the chest part of the body of the clients, we have this what we call very important landmarks. What we call the clavicle or the sternum. The prominent bone that we see in the chest part of the clients or in the sternum part. So the V1 will be placed on the right part of the chest and to be located at the fourth intercostal space. So this is the right part of the chest. We are going to locate this. For example, we're going to draw an imaginary line here to represent or describe the sternum, and then we're going to begin counting the spaces starting here in the sternum until to the fourth spaces, fourth intercostal spaces, right sternal and upper border of the sternum. Then let's palpate. Let's say, for example, I begin here at the border of the line. Then 1. Then let's begin to palpate. 1, 2, 3, 3, and 4 to the right sternal border. So we need to draw a lateral line going to the right sternal border. So This is the V1. We're now going to place the V1 on the located part. The next to be placed is the V2. Actually, the V1 helps to view the septum of the heart. And also the V1 also helps to view the septum also of the heart. So we're going to place the V1 on the opposite side of the V1. It is also located at the left fourth intercostal spaces on the left external border. So just place it opposite the V1. Here is the V1. Mm, mm. Next to be placed is the V4. So before placing the V3, we need to place first the V4 because to identify the location of the V3, it is very easy for us to identify the location if we're going to place first the V4. So make an electrogel. There are some breasts or those people who are gifted or having a big breast. It is very difficult to palpate and locate the fifth intercostal spaces or what we call the apex of the heart. But we need to remember a very important landmark if it is very if it is very difficult for us to locate the fifth intercostal space of the heart. We have here the sternum or the prominent part of the sternum. And we also have here, down below the sternum, we have here the xiphoid process. So, this xiphoid process, you're just going to draw a lateral line going to the left part of the breast. And you need to take note that this mid-clavicular line of the clavicle, you also need to draw an imaginary line going down until they meet each other. So, after doing that, this is now the fifth intercostal spaces or the apex of the heart. Wherein we are going to place the V4. So, sa mga malalaking dito talaga, kailangan nating iangat para malagay natin. Tandaan natin, we need to remember that the location of the V4 is very important to take note because it is the fifth intercostal spaces, mid clavicular line, the apex of the heart that will view the anterior part of the heart. And then after doing such thing, we're now ready to place the V3. So, it is now very easy to recognize the location of the V3. But first, we need to place an electrogel. So, between V1 and V2 and V4, you are now going to place the V3 diagonally. So, V3 will also help to determine the anterior part of the heart. After placing the V3, V5 is now ready to be placed. The V5 also will going to determine the lateral part of the heart. So, place an electrogel. The location of this V5 is found at the anterior auxiliary going down or just draw a imaginary line going to beside V4. Beside V4. And then the last one to be placed is V6. So the V6 also help to determine the lateral view of the heart. So in applying the V6, we need also to locate a very important landmark, which is the mid-auxiliary line. So the auxiliary or the mid-auxiliary line, just draw an imaginary line going to beside the V5. And so everything is set and placed already on the proper position. Then we're now going to let the ECG machine to obtain information about the heart of the client. So just let's wait for the result to be the ECG machine will going to come out. So wait for minutes. So assume that the procedures are already done, and you are now going to remove all the leads you have placed on the upper and lower extremities. Then remove. So after removing the following leads on the chest, we need to wipe the excess electrogel on the chest part of the patients. Then discard. Then we're now going to close the cloth of the patient. And then if the result come out, we are now going to document the following on the back part of the ECG paper. So we need to document the date, the time, the name of the patient, and also the age or the sex, and including also the vital signs, because those will be the basis or the information gathered to be used in diagnosing or in treatment. Then after doing that, you're now going to do an aftercare. So, all the materials you used, you need to properly return them on the right place. That's all for my ECG demonstration.